Hi everybody, I'm Dr. Gavin Scriven. People call me Dr. Gav, and with me is the founder of the non-surgical penis augmentation procedure we call Calibre, Dr. Jason Oates.
Thanks, Dr. Gav, and together we are the Dick Doctors, and we are going to be talking about all things penis. Our area of expertise is injectable penis augmentation. There's a lot to talk about penises, and together, myself and Dr. Gavin will be doing that. Hi, everybody. This is Dr. Jace, and with me is Dr. Gav, and together we are the Dick Doctors. We're the Dick Doctors from Calibre Clinic, and today we're going to be talking about the bent penis. Dr. Gav, do guys come in to see you with a bent penis?
Yeah, thanks for having me, Dr. Jace, and it's a nice way to start the conversation. Yes, the short answer is yes, they do. And a bent penis is an actual thing. There are certain conditions that we know of that can are responsible for guys having a penis that's misshapen or bent, especially on erection, and we know it as Peyronie's disease. And they often, I guess, find us because we obviously deal in cosmetic medicine and especially around the penis area, and they're wondering if we can help them out at all. They also see that we deal with patients with erectile dysfunction and other kinds of issues with the penis. So often we're a point of call for these guys with Peyronie's disease. And I believe you've encountered some other types of bent penises, Dr. Jace.
Yeah, so Peyronie's is one group, and then the other is fractured penis. So it sounds terrible, and in fact, when it happens, it can be quite distressing. So it usually happens during sex, and perhaps a little bit of misalignment, and the erect penis gets forcibly bent, and then on the outside of where it's getting bent, it can actually tear in the deep fibrous layer that is surrounding the erectile tissue, the corpus cavernosum. So when that tears and creates a split, by not being intact, when you get the erection, it forces the penis away from the tear. So it creates a bend away from the injury, which is actually the opposite to Peyronie's disease, where they've got a scar that forms and that prevents that deep fibrous layer from stretching when they get an erection. And because it won't stretch, it forms a constriction in that area, and the penis bends towards the lesion. So, although interestingly, the thought is that Peyronie's may be caused by small traumas to the penis that perhaps are occurring during sex, without it being a full rupture of that deep fibrous layer. So small traumas create a thickened scar and a bend towards it, and the big trauma, the fracture, creates a split and a bend away from.
Okay. And so what's your advice to these gentlemen who come to see you about these conditions, the bent penis?
Yeah. So normally they're not coming to see me at the time of the injury of the fractured penis. And another thing to remember, of course, is there's no bone in the penis, guys. So it doesn't matter what you call it or say, there's no bone there. So when you've got a fractured penis, it is not a fracture of the penis bone. Yes, there are animals that have bones in their penis, but not humans.
Thank you for clarifying, Dr. Jace.
Yeah, you're welcome, Dr.
Appreciate it.
I don't want guys out there getting the wrong impression. We want this to be strictly factual and getting good, solid medical information out to guys. So yeah, normally it's quite a bit later, and they're saying, "Yep, I've got this bend in the penis." There's no simple medical sort of treatment. Surgically, it is possible to do what's called a degloving procedure. So they make an incision around near the head of the penis, take the skin right back down to the base, find the split in the deep fibrous layer and stitch it up, or repair it. So that's possible. I think most guys, once they hear the description of the surgery, sort of start thinking, is there another option? And that's where we come in. So PRP, also known as the P shot, which we have discussed before, platelets, we know are full of these growth factors, lots and lots, 40, 50 different kinds of growth factors. And they've been used in orthopedics. They've been put into sort of knees and shoulders and elbows and stuff with sports injuries. And there seems to be some evidence there that they do sort of get some healing and improvement in cartilage. There isn't the same level of studies and publications in injecting for a fractured penis, but I've had a number of guys who have come in with this, and usually I've done multiple PRP shots into the penis, usually spread out over a number of months, and all of these guys have noticed a gradual straightening and strengthening of their penis. It also makes it feel a bit more stable as well. But what they can sort of report is that you can see a change in the angle and it looks straighter.
Okay, that's amazing. Really, I mean, that's quite amazing.
Yeah, but the great thing about PRP, platelet-rich plasma, being it's your own platelets, it's very low in risk of complications, and it's stimulating the body to heal itself, which you know, certainly fits in much more with sort of my idea of how we'd like medicine to work and to be able to heal. So it's been surprising, but it's been quite successful. Again, here's something we're going to have to write up and get a group of guys that, it's not that common. It's not as though I've had somebody every week, but I've had a handful of guys that it seems to have worked really well in. So I'm really happy to use PRP for a fractured penis.
Yep, and for Peyronie's, which we've talked about, it's either scar tissue or some kind of plaque formation in the deeper fascia of the penis, causing a bend towards that direction. We can use a similar technique of PRP injections into this area to stimulate formation of new tissue and try and I guess, release some of the tightening that scar tissue is forming.
Yeah, so the guys have two complaints here, don't they? They complain about the bend, and often they also complain about shortening as well. And they're both, no guy likes shortening. And I've had some guys complain about major shortening from their Peyronie's. But the bend can be so severe that the penis is sort of non-functional. If it's got a 90-degree bend in it, and some of these guys have very severe bends. So you've been doing a bit of PRP into Peyronie's. What kind of results are you getting?
Yeah, look, I think it's still in the what you'd call the experimental phase. Certainly, as you said, it's a simple procedure using their own blood, very low risk. So the great thing is that they, it's no complications, not much downtime really at all. It's a walk-in, walk-out procedure. I think guys are coming back already preliminary with some positive feedback. But I think it's still in the experimental phases for us because we just don't see Peyronie's as often as I would see or be doing other procedures. But certainly no complications, very low risk, and positive feedback so far.
I guess the main problem is that guys don't know that this is available as a treatment.
Exactly.
Yeah, and there are still only limited publications overseas of it as a treatment, but they do seem to be supportive. So that's a start.
And one other thing that I don't unfortunately offer here in Sydney, which is something you offer, is the low intensity shockwave therapy in combination with PRP. That could be helpful as well for Peyronie's. Yeah.
So again, it's had limited sort of published studies, but it's suggestive. The PRP shot sort of by itself was suggestive to have, some benefit, but, not causing all straightening. They were using, low intensity shockwave therapy by itself and got, some improvement, but not complete straightening. And so the obvious thing sort of then come to, well, let's use both and see if we can get better straightening. So we're still waiting to see some, more results with this. And of course, it's not an instant thing. Unfortunately, guys, you're not likely to have, one injection, one series of low intensity shockwave therapy. And just to remind guys, when we're talking shockwave therapy, it's not electric shocks. It's a more physical therapy, like a physiotherapist device, where it physically thumps into the penis, which is why I always call it the thumper. So yeah, starting to do that, and hopefully we'll see some really useful benefits. Something that has been available recently and is a stretching device. Now, stretching devices have been around for forever, for a long time, and have been suggested as treatments for Peyronie's, and there's publications on these. And again, they're all relatively limited in the benefit. There's a newer one called RestoreX, and maybe we can have some details put at the end of this. It's a stretching device, so it grabs the penis by the head. It's got these rods that come down to a ring around the base of the penis, and it stretches the penis out. But you can position sort of anywhere along it a hinge, and the idea is that you hinge the penis over this smooth fulcrum that's in the middle, and you bend it away from the tightening. So you're stretching that out, and that seems to be sensible to me. You can see how that is much more likely to create stretch into that fibrous plaque than just the penis straight. Then the logical thing would be to combine it with a PRP shot into that plaque. So we don't obviously have any financial link to RestoreX at all. I send every guy that asks me about it to their websites, but it's not an instant thing. It's going to take time. It's going to take real dedication. In fact, they go through it very carefully on their website, showing how to do it. But it takes hours of treatment sort of every day over a period of months to get that sort of benefit. But I think it's really worthwhile, and I certainly think that's something guys should definitely be looking at.
And I think, of course, coming back to what you mentioned before for the fractured penis, where there's a surgery available with Peyronie's, if it's that severe, you have a dysfunctional penis that you're not able to, have intercourse with, and it's almost a 90-degree bend, then of course there is surgery available that you can consult with your urologist and talk about the surgical options for Peyronie's.
Unfortunately, the most common surgical option is to tighten the fibrous layer on the opposite side to the scar and shorten the long side down. And so the most common complaint with Peyronie's surgery is that it's straightened the penis, but it's made it shorter. Guys are never happy with that. There is surgery to excise the plaque and place a graft in there. Much more complicated surgery with a higher rate of complications. And I don't myself know any urologist who does that surgery. So yeah, most guys aren't rushing in to have surgery. Dr. Gav, do you find that guys come to you and ask about Calibre and using fillers to disguise the bend in their penis?
Absolutely. Yeah. I mean, I think, and they draw the conclusion themselves, which is quite clever, that if you can put dermal filler in the shaft of the penis to create extra girth, well, can you then create a straighter shape of the penis? So yeah, absolutely. They come to me and ask if I can do this for them. And I guess the question, there's a couple of things we need to take into account. One, how severe the bend is in the first place. And this bend is normally most noticeable on erection. If we're going to try and straighten the penis from just a cosmetic point of view with dermal filler, we have to place the dermal filler on the side of the bends, or where the concavity is.
Yeah.
And really that's for when it's erect, to look straighter on that side that the bend is in. But inevitably when the penis is flaccid and not in the erect state, if we put a lot more dermal filler on that side to fill in that gap, then you're going to have, I guess, a bulge or a large amount of dermal filler on that side. when it's flaccid, and it will look slightly unnatural.
Yeah. 5, 6 years ago when I had the first guy come, it wasn't a huge bend, but yeah, he just wanted it to look straighter when it's erect. And I thought this was a great idea, that I would just put a little bit more filler on the concave side. And he came back and so I said, well, it's great when it's erect. Yeah. And we did the treatment while the penis was erect. So we used one of those erection injections,
Yes.
got it nice and straight. And then he came back and saw me a couple of weeks later, and it was a bit like a turtle shell sort of on the side of his penis.
All right.
There's a definite bulge on that side.
Yeah.
And actually, he didn't mind it that much, but I certainly sort of noticed it. I will only do very, very limited sort of asymmetric injections for a concavity. Sometimes it'll be a little bit is worthwhile, but yeah, you just can't chase a big bend, can you?
No. And I guess the other question is, guys, with Peyronies, of course, are looking at our procedure just from a penis enhancement point of view, and wondering if they can still get an increased size in their girth, and if they're still suitable. And I mean, the answer is yes, of course, they're still suitable. We can still do the procedure.
Yeah. So at least there's a bunch of treatments that are available for the bent penis. With Peyronies, I'd be getting guys, look up RestoreX. If you then want to maximize the benefit from your RestoreX, get a P shot, get the PRP injected in. If you've had a fractured penis, then really it's have PRP injected in there.
Excellent. All right. Well, it's been enlightening again talking with you, Dr. Jace.
Great talking to you, Dr. Gav.
And, we're the Dick Doctors with the Penis Show here today. And don't forget, guys, confidence changes everything.
Great. Look forward to talking to you again soon.